Hello, I'm Mark Chatwin. I'm going to be the moderator of this panel, PD07, on a fast European response to the pandemic using technology and joint investment. And I'm joined by a very distinguished panel, and we're going to have an hour and a half of discussion, which I very much hope will involve you as our virtual audience. Now, I'm sure you're familiar with Zoom, but as our virtual audience, and I can see it's growing quite rapidly, there's a Q&A button probably on the bottom right of your screen. And if you open the Q&A tab, you can ask questions and answers. We'll do our best to include as many of them as we can. So as you're listening, I would encourage you to ask questions. Let me introduce my panel briefly. All of them are so distinguished that I won't attempt to give any kind of summary of their careers, but simply to explain what they're doing at the moment and why they're on our panel. So the first person we'll talk to this afternoon is Dr. Andrea Ammon. She is the director of the European Centre for Disease Prevention and Control. She's a very distinguished public health figure and spent much of her career at the Robert Koch Institute.
Yeah.
It so happens the second person we'll speak to is the current president of the Robert Koch Institute, Professor Lothar Wieler. So there'll be a Robert Koch flavor to the first 20 or 30 minutes of our discussion. And the final participant in this first conversation, which will really focus on the impact of digital on the pandemic and on health, is Dr. Jürgen Müller, who's the Chief Technology Officer of SAP. He has a PhD in applications optimized for in-memory databases and has been at SAP since 2013. Dr. Müller, I'm ashamed to say I don't even understand the subject of your PhD, much less the research you did. But
yeah, in normal times after the session, we could have some time together.
Good. Anyway, thank you for joining us. And then our second conversation, which will focus on the European response and on the kind of joint actions that can be taken together, which include investment and technology, will be started by Dr. Christian Buschoi, who is the chair of the Committee on Industry, Research and Energy, and maybe most significant for us today, the rapporteur of the EU for Health programme in the European Parliament. Dr. Buschoi has been delayed, but will join us in a couple of minutes' time. And then we'll speak to Mr. Olivier Charmet, who is the Executive Vice President for General Medicines at Sanofi. He's occupied several positions at Sanofi as a member of the executive board, a member of the FPA, the European Federation of Pharmaceutical Industry Associations board, and was head of Sanofi Pasteur, the vaccines division of Sanofi. So welcome, Mr. Charmet. And then finally, Ambassador Stéphanie Cenu will join us. She is the Ambassadrice pour la Santé Mondiale for France. As the Global Health Ambassador, she represents France on many international bodies, and her previous positions in government include being in charge of government policy on human rights and health. So that will be conversation two, and you can see that Ambassador Cenu actually is in Berlin today, which is why she has a Frankreich in Deutschland poster behind her. So I think that makes you unusual, Ambassador. And then we have two respondents, because we don't quite know how this virtual panel will work. We have two people who are professional, and Dr. Buschoi has just joined us. Welcome, Dr. Buschoi. Dr. Buschoi, we should also note, is a medical doctor as well as his policy achievements. So good to have you with us. And then we have two respondents at the end who are going to professionally listen to what they've heard and do two things. One is brings different perspectives. And so Lily Parsi is the Director of Policy at the International Longevity Centre in the UK. She's substituting today for Baroness Sally Greengross, who was to join us, but is feeling a bit unwell. So Lily kindly stepped in at the last minute. The particular focus of Baroness Greengross and of Lily is on the health and well-being of older people. So they'll be looking for that thread, and clearly that's something which has had a particular resonance throughout this COVID pandemic. So they'll be looking for that thread. And then Professor Federico Lega, who, as I mentioned, is the president of the European Health Management Association, will be looking for the trends that may affect the way health is delivered, that may affect the way healthcare systems are structured. And he'll be looking for themes and gaps that he'll address on that. So that'll come at the end of our panel. So I fear the great frustration will be you won't hear enough of anybody, but we are going to have excellent content for the next hour and a half. And I do encourage you to both join us and to tweet. So I have put just around me there the hashtag for the World Health Summit. You can see the World Health Summit digital banner on Twitter. Please do feel free to tweet any of the content you hear, your thoughts about it. I'll try and keep an eye on Twitter on my other screen. And certainly I'll keep an eye on the Q&A panel. So if you'd like to join us in the Q&A panel, ask any questions and we'll try to integrate them into the conversation. So Dr. Amon, if I may start by asking you about how better data collection and shared access to data can help in future health emergencies. In July, I know the trio presidency, the German, Portuguese, Slovenian presidency, committed to strengthening the Ecdc and to a European health data space. And I know the Commission is preparing proposals, but what do you think this strengthening might include? What should it include?
You mean the strengthening of the ECDC? Okay, so good evening to my co-panelists, some I have met earlier, and to the audience, of course. The proposal of the Council to strengthen ECDC was has had several elements that they brought forward in July, and that one was to improve the European surveillance in terms of finding digital and innovative solutions, but also to strengthen preparedness in the countries, but also at EU level, to create a health task force to support the countries in all these activities, to be able to issue non-binding recommendation and have a more global visibility. Now, the Commission is preparing legal proposals for that, also for actually strengthening the mandate of the Medicines Agency. And these proposals will be put forward in November to the Parliament and the Council. And then we will see what really comes out at the end. You are muted, Mark.
Thank you. I was taking my own advice too seriously. I was telling the panelists beforehand to please mute themselves when not speaking. Of course, the important bit of that advice is to unmute yourself when you speak. The difference, I think, between this pandemic and earlier ones, and it is maybe a difference that will be reflected in some of the changes to the international architecture, because the connections we have and the speed we travel at has made this unlike anything we've seen before. And I saw something you said about the March return of skiers from alpine resorts and the speed with which that had spread the virus around Europe. What does that tell us about monitoring and data in the future and how they could let us act earlier to stop the spread of future pathogens?
Yeah, I think it's actually, I mean, of course, compared to the pandemic 100 years ago, it went much faster. But I don't think it went actually faster than in 2009. So but what we have learned, and my takeaway from what we have seen now, is that at the time when we were seeing the first infections, actually the virus was already pretty much spread. But we didn't have the testing strategies that we actually could detect it. And the event in March with the skiing holidays, that made it visible. So I think we have to be also taking into account that not everything that we are not seeing is not there. And of course, the hope is that with digital systems, the recognition and capturing of the information could go earlier. On the other hand, to be really specific in terms of really laboratory diagnosis, it is COVID. That the digitalization alone will not help, because here the good old laboratory still has to do its job before. And as it happened in February, March, and into April, there was a scarcity of testing kits, personal protective equipment, lab materials. So the tests were not done in a broad enough manner so that we could capture everything. So that of course is not something that the digitalization can solve. Digitalization can solve from the moment the result is there and then reported and collected.
And so to get the result faster, do we need better diagnostics, or do we need better systems for managing the diagnostics we have and for automating them, for example?
I think we need both. I think what we should not forget with all the euphoria on digitalization and artificial intelligence is that there are basics that at least at the moment cannot be captured by these digitalizations. So, but from that moment onward, and that would help greatly, because what we saw is that this whole reporting forward was delayed because the people that need to be involved in the reporting right now had other things to do. They had to find cases, trace contacts, monitoring cases and contacts, and then so we had a considerable delay in getting the data, and that is something that can be improved with digital solutions, and also the completeness. If it's more a pull mechanism instead of the push that we have right now.
Do you think we have enough data to know about the relative impact of the different kinds of lockdowns? So I appreciate all you've said about data being slow, about it not necessarily being aggregated as efficiently as it should be. But do we know enough to know which models of lockdowns, which measures work, or is that simply beyond our capacity now? You're on mute, Dr. Amon.
Thank you. Right now, it's a bit difficult to disentangle the single mechanisms and measures, because they are, I mean, in March, April, they were applied as a full package. But even now, they are coming with not a single measure and then waiting until comes the effect, but then measures are nations. So it is not very easy to exactly determine the effectiveness of each single one. Where we have some more insight is the school closures, because that was the first measure that several countries opened as the first relaxation after the principal measures in April were applied. And there we didn't see that a large increase. So that leads us to the conclusion that school closures are probably not a very effective measure to reduce the cases, and should be only used as a last resort. But that is not possible for many of the others, because they were bunched together, and then you can only say something for the package.
Yeah, and it's, some of them have been changed so fast that it's difficult. Yeah. So if I may, Dr. Hamann, I'm going to turn to Professor Wieler, because he obviously has a national perspective on this and is coping with many of the same issues. I saw you nodding frequently while Dr. Hamann was talking, Professor Wieler, but I have this sense that overall, across most of Europe, outbreak preparedness has been kind of this forgotten corner of medicine. We all knew it would be important one day, but we hoped it wouldn't be, I suppose. Do you have that feeling, and that maybe it's catching up with us now?
Yeah, so first of all, thanks for being part of this wonderful panel. You always only like to pay for the insurance and for the firefighters if they are on the place. I mean, this is common knowledge, basically, and it's particularly hard to convince politicians in peacetime to prepare for this. I hope they learned the lesson with this pandemic. But let me briefly come back to this issue here. You mentioned that I have a national perspective, and Mr. Müller will soon come in and give some more details about some technological issues here. But what I want to say is that on a national point of view now, we saw a rapid advancement of digital tools supporting public health action. This was enormous, and some key health data and information from the point of care, the lab, or the community is currently already automatically collected, which hasn't been the case in March, I have to say. So we have already the possibility to give feedback and to put data, basically in real-time data, into political, to give recommendations to political decision makers, which is a quality that is not, I'm not fully happy with how it works, but it's much better than it has been 9 months ago. And I have to say, we really are now able to guide public health decisions on these actual data. And what I want to say here is, this is something through my whole life, this is an experience I have. You can only do this if you have great partners. And this year now is a partnership between health and IT industry. It is very, very clear that the Robert Koch Institute has had a lot of expertise in epidemiology and virology, in surveillance in particular, epidemiology. And surveillance is of utmost importance. But of course, we don't have huge skills in when it comes to IT. So basically, we have to join up, and this worked really nice over the last month. And with this continued development of health data technologies, I think we're moving forward to better guide our decisions in the future. And I hope this will move on, and this will go on, because it's an investment. It's a huge investment, I have to say, to keep this alive and running. And I'm optimistic that this will move on, but I'm not sure about it. So the question here is, what kind of data do we need? And it is very clear that if these data are digitized, they are much better available, and they can be much better compared if they are in the same format like other data. And that's also, I mean, that's common knowledge, but to bring it into living is really another story. And what we learned over the last month, instead of lengthy scientific publication processes and fast outdated scope, we saw also a rapid increase in preprint publications, which is also something that is very different to the times before. And not that, I have to say, not that every and each of the authors really put so much efforts in ethics and responsibility, as also some publishers did not. But in principle, this is also only possible through digitization. Yeah, that you have preprints on the web is something that also gives a totally new aspect to scientific knowledge being spread rapidly into the community. The problem here is, if people read this without having the scientific knowledge behind it, they may, of course, also make wrong decisions from this. So that again, the expertise comes into place here. No? We have data from the community, from people themselves, so-called citizen science projects, which are also very, very important. For example, people reporting their disease symptoms or something like this, which is very important because it's real data and real-time data, which we need as some asset to make our decisions. And something that Herr Müller will talk about is contact tracing, of course. Contact tracing, I think we've heard in the session before, contact tracing, making the point of infection clear and breaking infection change. This is at the heart of bringing down outbreaks. And a pandemic is nothing but thousands of outbreaks. And so there we can be better with digitalization, for sure.
But that self-reporting, that contact tracing is largely happening through the app. And you're right, we will speak to Mr. Müller about it in a minute. But I see from the Cosmo survey, which I think the Robert Koch Institute participates in, that only half of Germans think the app is an effective way of containing pandemics, although to the rest of us, I mean, a lot of us look to Germany and see it as the model for how to begin these apps. So how do you explain that?
I mean, if half of Germans think that this app will be the key to contain the pandemic, 100% are wrong of Germans, because this is only one tool. Yeah, it's one tool. I think maybe this is to put in perspective what I always say. We have a large toolbox, and I think in Germany we have over the last months added more or less every month or so a new tool, but it's only the combination of these tools that make us handle this pandemic. But the app is one tool, I have to say. It's one tool only, but it's a tool that is efficient, and Mr. Müller will have more insight into this. But again, it's one tool that fills in a niche that otherwise can't be filled, yeah? Because if you have context that you can't remember of, and then the app can make a difference. Absolutely.
So let's ask Jürgen Müller about that app. Mr. Müller, I will come back to some of the points that Professor Wieler raised about the impact of the app and its place in the toolkit. But I'd like to step back a moment and look at its development. I mean, it's the result of an unprecedented open source collaboration. And I believe you even published the code to a computer hacker group, right?
Yes. So really, thanks for having me on the panel, and also thanks for putting digitalization so high on the agenda here. Yes, Mark, that project was, to the best of my knowledge, the largest German open source project for a public project. So really, after actually a bit more than a week, we publicized first documents of the use cases that we are going to tackle with the Corona One app. And then also a couple of days later, we described how that would work from an architecture perspective. And we did see a good pickup. And I think that was really also the reason, because we went public with this. So there was complete transparency, complete openness, complete trust. We have a chaos computer club in Germany, and basically the main task of them is to criticize everything around data protection that is not perfect. And with regard to the Corona One app in Germany, they had nothing negative to say. And our developers really celebrated this, because they can't endorse, and they don't endorse anything, but if they don't say anything negative, this is the highest rating you can get. And I hope that also, like how we develop this app, that especially if the public pays for such a project, that then it is also open source. And we had some other countries also completely reusing the app, and that is fine. I mean, we need to stick together to get through this together.
So that confidence that has been built around the app has enabled it to play quite an important role in the track and trace operations in Germany, right? And in the self-reporting as well, I believe. Can you tell us a bit about that?
Yeah, I can, Mark. And yeah, first of all, you said track and trace. So there's a lot of debate. So it does not track anyone. It's really about contact tracing. So we don't share any personal information. So there's pseudo data keys that are shared that cannot be traced back to a device or a user. So that is super important. And I think that was, especially in Germany, of course, in different countries in the world, there's different philosophies on how to tackle this, but especially in Germany and many other areas in Europe, I would say, this is very important that we can, the system cannot be hacked because there's no personal information in the system.
Do you think that the uptake in some other countries is because there's less confidence, maybe because the system design is different, or because there's less confidence inappropriately in the app, if I can put it that way?
No, I think so. In Germany, we have now 20.4, 20.5 million downloads roughly. In other countries, like in Ireland, also a lot of people download the app. UK now as well. So, and all countries have a little bit of different approaches to it. So in the end, as long as countries are successful with it, for example, in the UK, you can use the app and scan the entrance of a pub. And of course, if that helps in some shape or form to A, being able to go to a pub, and B, still being traced if there's an outbreak, then of course that also helps. In Germany, so when we talk about how often has this app been used and did it really help, so we don't have all the information. So when Professor Wieler and I, for example, talk in an ideal world, and someone mentioned that, in an ideal world, we could have all the privacy and we could have all the statistics for the epidemiologic models, etc. But there is either or. We can't have both at the same time. And sometimes it's even funny because the same then, for example, journalists who said you must not have private data in there, and the same journalists say you have to provide all the information, all the statistics, how the app works and how many people are warned, etc. I can share with you that more than 2 million tests in Germany were transmitted digitally via the app. I can share that more than 15,000 positive test results were shared in the app. And just yesterday, for example, I talked to my brother, and in the last 2 weeks, he basically only made it twice via public transportation to his work and back. And he had 3 encounters with low risk. And then maybe we come to this, of course, like you can use the app, so you can like apply a factor that actually it would be more people being tested positively in the last 2 weeks. And then we also know that not all users share with the public when they have been tested positively. And then you can have another factor on that. And that changes his behavior. So he, of course, says, oh, if I don't have to, he has 2 young children, I don't have to, why should I risk myself and my family? And therefore also these, like, even if it's low risk encounters, from my perspective, help changing the behavior.
And I think it could have, I want to bring in a couple of questions that we've received from our virtual audience, and remind people that using the Q&A button on the bottom of your screen, you can join this conversation. But that kind of voluntary app, which helps people assess their own risk and make their own decisions, could have some fairly far-reaching consequences beyond even infectious disease in the future, couldn't it? I mean, if we get used to the idea that we can trust these apps.
Yeah, I don't know if you, also Professor Wieler, if you want to jump in. So we really focused on Corona, and it's a very purpose-built app. So there's no plan to expand that, and that probably also would need some other legal grounds. And Professor Wieler knows that we produced more legal documents and paper than we produced source code of software. So maybe yes, I would say, Mark, but also we have to be considerate of what we want to achieve and how we then do it.
So Jana Broadley has put in the question, what kind of, and it's a question to all 3 of you, what kind of concrete actions can be taken by the EU on the global level in the short to medium term, meaning 1 to 5 years, on digitalization and data and health? And I think implicit in that, can the obstacles to that action be overcome? Who would like to start? Professor Wieler, Dr. Ammon?
That's a question for Dr. Ammon, lady here.
Thank you for the hot potato. So I think there are several actions that are actually already undertaken. And the main view from the EU level is really to make things interoperable. So there was recently a guidance, I think, and also a platform how to make the apps interoperable. If possible. There is the development of the European health data space, and of course the ongoing work on the electronic health records that in particularly are designed for cross-border movements. You know that it has started already with these electronic prescriptions that some countries now share with each other, so that patients going from one of these countries to another one can actually access from this other country their prescriptions. So there are elements going forward. From our point of view, when we want to have in mind the digitalization of surveillance, what would be important from our side is really the inclusion of information that is necessary for public health into this electronic health records. That is in very few countries actually the case, because these health records are developed for some other purpose, not for public health surveillance. And the interaction between public health and those institutions developing the health records is not in all the countries very, very good. So trying to link these and also come up with a proof of concept study whether these, in principle, it would be possible to use the electronic health records for collecting surveillance data. And of course, there's a whole bunch of other considerations beside the technology. And the content, it's also the whole legal and data protection issues that have to be solved. It is, well, not least the training of public health staff using these electronic means. So there is, it's fairly complex, but I think if we don't start doing this, we never sort of get even to the point that we can start finding solutions for these obstacles.
We should probably note that this week, if I had been able to come to Germany, with my Irish app, I would have had full interoperability of my Irish app with the German one. And were I able to go to Italy, it would be the same, right? So the three countries, yeah, fully interoperable.
Also, when, very tangibly, under the app, the German Corona 1 app is published by the Robert Koch Institute, and we are happy to be a partner. And yes, that is also something very tangible, what is happening right now. So as you said correctly, Ireland, Italy, Germany, the apps are already interoperable. Latvia will come soon, and soon after, according to the latest I know, Denmark, the Czech Republic, Spain, Croatia. So that is something that we can do if we now also have to assume that the pandemic will not be over in the next couple of weeks or months. But still, we want to have travel within Europe. So that is something from a technology perspective, what we are currently doing in order to help on that front. It does not solve all problems, but it helps with this piece of the equation.
Perhaps I can come in answering this question that was asked by the lady in general terms. So all people who have to make decisions during this crises, and it's obviously an outstanding crisis, all of them want to have data that these decisions are based on. And we were asked so many questions and so many information. And I give you two examples, which are really simple examples. One, how many tests are performed, how many tests are positive or negative, the ratio of the tests. We didn't know this because there is no legal base to get the information from the laboratories in Germany. Now, on a voluntary base, these data are collected, but on a voluntary base. But they are detected every single day they are coming together here now at the Robert Koch Institute. This is digitization. Secondly, the number of intensive care units that are able to run. This is logistical of high importance. I mean, nobody of us wants those beds to get filled. That is clear. At least I'm not interested in this. I don't want to use this capacity, and nobody, I guess, on this panel wants to do. But if you have a number of patients and you want to put them to a hospital, you want to know whether this hospital is able to take up the patients. And now, currently from Belgium, from Netherlands, already patients are being shifted to Germany because in these countries, the capacity is already overwhelmed. So this is a logistical information that you can provide. And this is only done by digitization, yeah, to make it very clear here. So if this crisis doesn't lead European leaders to finally come together and exchange certain data in a certain format that is harmonized, it's a waste of a chance. If now digitization will not make its pathway, then I'm personally convinced this will be never forgotten by the people. This is a chance that we have to take and we have to make it. And if this crisis doesn't lead to the improvement of digitization and data sharing, then what else can we have? And the European population, as well as other countries, also other nations and outside of Europe, the politicians have to take this responsibility. Yeah, it has to be, because we have talked about this since decades. But if you talk about it in theory, everybody says, okay, let's see whether we really need it. But now they see that we need it, and now they have to move it forward. And therefore, I'm pretty optimistic that they will take this duty.
Professor Wille, you're doing my job for me. You have just paved the way perfectly to speak to a senior European politician, Dr. Christian Buschoi, who has very kindly joined us today. And sir, I mean, you bring to this 3 or 4 different perspectives. You're 1, the elected official on the panel today. You're 2, the rapporteur for EU for Health, but you're a medical doctor and you've run a health system. Or you've run an insurance fund, I should say. So I think you bring a lot of perspective. And Professor Wille says, if this doesn't change the way we integrate things in Europe, nothing will. Can I ask you to comment on that first, and then I'd like to talk a bit more generally about cooperation between member states and the EU.
Yes, thank you very much. I'm also honored to be here to participate once again this year in this very prestigious event. This year in a video format, in an online format, but technology helps us to remain interconnected. I was the president of the National Health Insurance House, which is our health fund. It's an official governmental position. And I have the perspective of the national issues, but also European issues. I agree that it is a good momentum. I'm not sure if we do not act now, we'll never act, but it's clear that we should act now, and we should use the lessons that we are learning to make our health systems more resilient. We can do this with the support of European instruments like EU for Health, the program that will start 1st of January next year. I'm the rapporteur, as you mentioned. We should put more emphasis on research and innovation, and we have Horizon Europe and the health strand there. And I was responsible of this also during the previous mandate. And now, as president of Industry, Research and Energy Committee, we are looking to the whole Horizon Europe, and we have a lot of expectations that will help us also to be better prepared for future crises. Research in health is just one dimension, but also digitalization, Green Deal, and all the others that could help our economies and our societies to be better prepared for the future. We have Digital Europe. We could find there digital solutions. And of course, we have many other initiatives, plus the funds that are allocated to the member states. I give the example of my country, Romania, and I spoke with my colleagues. I'm from the governing party. I'm the vice president responsible with health policies, but my colleagues are in offices as Prime Minister and also Minister for Health, we have a government until elections with just one party. And from the European funds, from the next period, more than 5 billion will invest in health. 2.8 in a special operational program, 7 years from MFF, from multi-annual financial framework, and 1.8 from the recovery, from the next generation, for investments that should take place in the next 3-4 years. And this, I hope, will be repeated by other countries, which will be also the case for other countries which have at their disposal money from European funds. Part of them should go to health, and of course, important part of the money that are going to health should go in digital solutions for health. This is something that is highly encouraged by European Commission, by European institutions, by all the policy incentives and signals that we send what we are working in Brussels.
In that digitization, though, a lot of the challenges seem to be around trust on the one side. Do citizens trust the apps? And we heard from Mr. Müller the lengths they went to in Germany to try to build that trust. But on trust on the one side, and there are some countries where that trust is clearly lacking. And on the other side, ownership of data. Who owns data? How fast can it be shared? How freely can it be shared? Do you see a role for the European Union in overcoming those challenges?
Yes, I believe that we could work together in order to increase the trust. And on privacy, we have already a lot of good and strict rules, even from which is not only for health apps, it's for everything. And these rules could apply also. And I believe that also we have a very, very strong tradition of taking care of people's data. Of course, the only strong guarantees are the legal ones. That's why we should look closely to the European rules, to the national rules, and see what we can improve. As it was stated before, and I liked very much what was said, we should find a good balance. The perfect situation is to have all the data that we need, all the informations, in the same time, the perfect privacy, zero risk for intruding in those data, or even to use in a bad way. But this is not always possible. We have to find the right balance. But also, I believe that the population, the public opinion, the citizens, and also the policymakers from different member states are now more open to go in this direction, because what COVID-19 highlighted a lot, beside our lack of preparedness, the need to invest more in health, the fact that we can experience shortages, not only in medicines, but also in equipments, and also we do not have enough medical staff. The beds for ICU are not enough. But another important lesson, and what COVID-19 has also highlighted, it had highlighted the need of digital tools and services in order to enable continuity of care, like self-care and self-monitoring. We need to have more telemedicine, and of course we need these applications, e-health applications, be the ones which could monitor pandemics, public health situations, but also, why not, little by little, also personal apps which could monitor our health and could help us also to improve our healthcare, to improve our prevention, and also to monitor our treatments and how these treatments are efficient or not. These are ideas that are more and more accepted by general public, are more and more accepted by policymakers. It's important to give them the trust. And this we could build together, European and national governments.
I have one quick question to ask you before we move on, Dr. Bolshoi. One other thing that I hear a lot from ordinary citizens and from specialists is that Europe has become too dependent on other regions of the world for health goods and, as you mentioned earlier, for health R&D, and needs to do more itself within the European Union. Is that a view you share?
Yes, I share, and we already try to address this in a report in European Parliament. It was joint work of Environment, Envy and Health Committee and the committee that I'm chairing, Industry and Research, because it's clear that the Union is indeed dependent on external production and sometimes, unfortunately, external innovation capacities. We need to address the lack of new medicines and vaccines and innovation throughout the chain. When we are talking about the shortage of medicines, which is known to have many roots, or the weaknesses of the supply chain, we should take into account that this translates into lack of access for patients to their necessary treatments. That's why we need solutions, and we expect from European Commission the pharma strategy, which should be released soon, and then we'll discuss in the Parliament, the Member States will discuss in the Council, and I hope we'll find not only the best solutions, but also the most practical solutions, because we need also to do something quick. For innovation is paramount to fuel innovation, and here I mentioned Horizon Europe, but also we need to involve Member States in order to boost innovation and research, and also we need this in order to remain competitive at a global level, where other regions like China, more and more, US of course for decades, and they are still leading, Japan, and not only, are investing a lot, and moreover are strengthening IP rights, intellectual property rights. So Europe should increase the investment, should follow the pathways in order first to avoid brain drain, which is a situation that we are seeing more and more, and not only versus United States, but very, very difficult to believe, but it is more and more the situation even versus China, not because of the salaries, not because of the conditions, but there is a program which for very good researchers, they are tailoring the labs for their wishes. And of course, as a researcher, if you go there and they build a lab exactly as you want, it's something very, very appealing, very interesting to do. So in order to avoid brain drain and also shift on research and the development and clinical research, giving early access to you patients, we can save lives if we are doing so. This is for innovation. On the shortages and on essential goods, medical goods, be it medicines, drugs, or even equipments, of course, here we should find the best incentives in order to bring back in Europe some of the manufacturing capacities, which now are mainly in Asia, in China, and we are very much dependent, and it's also strategical weaknesses, because a lot of our import of generics, so essential medicines, which do not necessarily involve innovation, but they are essential and base medicines, we are depending on 3-4 sites of production which are in China, and this is strategically very, very challenging. So we should bring back or bring to Europe, because some of them never were in Europe, some manufacturing capacities, but also to scale up, to reinforce what we already have as existing capacities of production, because we have in many countries, Western European countries, but also even in Central and East European, even in my country, Romania, we have already manufacturing capacities. We just have to reinforce them.
Thank you so much, Dr. Bolshoi. So that actually brings us beautifully to somebody who hasn't yet joined the brain drain, and unless Mr. Chalmet, I think you're still in France, not in China. So we still have you in Europe, I think.
Absolutely.
So I mean, you heard Dr. Bouchoy say there's this need to reinforce our capacity in Europe. He said we need to remain competitive. We need to fuel innovation. As a company involved in the fight against COVID-19 and having to do a lot of this at high speed, what have you learned and what have you seen about where we need more union capacity?
So, of course, the pandemic has been a shock for each and everyone. On my side, I was in the US when President Trump declared the state of emergency, and I left the US by almost the last plane to Europe mid-March. And I arrived in Paris, and then I was put in quarantine because I had been exposed to COVID positive people in the US. So, of course, we all learned a lot. And with regard to the Sanofi journey, we had two obsessions. The first obsession after the announcement of the confinement was to make sure that we could ensure the continuity of drugs vis-à-vis the patients. It has been an absolute obsession, and other pharmaceutical companies did very well during that period of time in order to make sure that we supply patients, because any discontinuity is, of course, a big issue. The second thing that, of course, is very important, and we have been obsessed by that as well, was really to make sure that we were working days and nights in order to develop treatment or vaccines and be able at some point to manufacture COVID vaccines and treatments. As we progress, we have two vaccines in development. The most advanced one is leveraging technology that we have developed, which is a recombinant protein approach technology. We have worked with GSK, and we've shown here who's going to bring its adjuvant, which shows again how here the virus is not at the scale of one company. We need to combine forces in order to make sure that we are successful. And this vaccine candidate is currently in phase 1, phase 2 clinical study, and we are expecting to get a first regulatory approval by mid-2021. We have also a second candidate, again with a partner, Translate Bio, using a new technology called messenger RNA, and we anticipate here the initiation of phase 1-2 by the end of the year. I think what we want to make sure is that we make the vaccines affordable and accessible. And we are very happy to have been able to sign with the European Commission some advanced purchase agreement for recombinant vaccines. Will put us in a situation that we will be able to provide up to 300 million doses to EU citizens. It's also important for us to make sure that our vaccine is accessible to population in an equitable manner. And this is why we are in discussion with the COVAX facility, which is a global collaboration of governments, of philanthropists, in order to make sure that there is an equitable access of the vaccine. What we learned in the last few weeks, few months, is that the pandemic has demonstrated really the importance of collaboration. And it's a global collaboration between governments, between academia, between companies. It has also shown us the strategic importance of the healthcare system in order to make sure that we continue to invest in healthcare and we continue to invest in pandemic preparedness.
I just want to remind our virtual audience that you can use the Q&A button at the bottom of your screen to ask questions. We have a number of interesting questions for later in our discussion, and you can also tweet using the Twitter handle that's on the screen here. Olivier, you talked about this public-private collaboration. You gave a couple of examples of it in relation to vaccines, but there's going to have to be an evolution of public-private partnerships, isn't there? And maybe even a fundamental change in the nature of those partnerships. How do you see them evolving, and what do governments and companies need to do to realize them?
I think there are a couple of things that are important. First, there is an absolute need to develop long-term collaboration. It's not a short-term, it's really a long-term collaboration. And it's also the absolute need to develop end-to-end approach. And this is what the US have done with BARDA, and I was very happy to hear the progress that have been made by the president of the commission in order to make sure that we developed EU BARDA. This is, of course, something that is very important because we know that when we are going to be out of COVID at some point, another pandemic can happen. So we need, in order to be able to fight against the virus, to build a very solid plan, to have a very clear strategic plan with a very clear mission. And I think the EU BARDA could definitely be an opportunity in order to make sure that we build strong partnership with partners. The second thing which is important is, of course, to make sure that there is enough funding to support the development of those private-public partnerships. And it's of course the amount are important, but the consistency of the amount are also very important. The third element, which is an important element, is that the importance of having a regulatory and legal framework in order to be able to move fast in case of emergency, respecting, of course, the need for safety. This is absolutely evident because public health and healthcare are, of course, very related to public confidence. And the new global public-private partnership needs also to be flexible enough so that there is the opportunity to use different variety of contracts to fund different projects. So yes, I'm very optimistic for the future because what the latest discussion I've brought is that the importance of getting prepared. And I see, of course, opportunities looking at what has been done since 2006 in the US by BARDA. And this, if we are able to build, our European BARDA, that might be a little bit different, this gives me confidence that we will be able to get better prepared for the future.
And quickly, because we're running a little bit behind, but quickly, would that better preparedness help us prepare for future pandemics better? Are there other things we should be doing at the same time?
No, I think if we have an infrastructure, and what the US BARDA brings, it's an infrastructure. So it's a set of agreement, it's a framework I alluded to on the regulatory and legal framework. So I think this will allow us to move much faster. But of course, the second element, which is absolutely key, is the country preparedness plan and the harmonization of this country preparation plan. So each and every country needs to make sure that it develops a good pandemic preparedness plan. The last element, which is important, is that, of course, we have been observing the strategic importance of data. So to make sure that we are very fortunate, we have in Europe very good routine electronic surveillance system, but those data needs to be shared up front so that all the stakeholders, understand the speed of evolution of the virus, are able to understand how it moves. And the more we are able to connect and to work from the beginning, I think the better it will be.
Yes, yes, and I'll come back to that in the discussion in a moment, if I may, Olivier. Ambassador Cenu, I should warn you that I already have a question from one of our audience for you, which I'll ask you in a minute. So somebody has a question she's very keen I ask you, but let me start asking you in the light of the discussion we've been having with Dr. Bouchoy and with Mrs. Charmet, what do you see as the challenges and successes of the EU in facing COVID-19 and this unprecedented crisis?
Well, thank you very much, and take the opportunity to greet my colleagues on the panel and the audience as well. So challenges first. Well, of course, the COVID crisis has disrupted most health systems, and in Europe it has definitely highlighted our shortcomings. We have seen weaknesses appearing in the European Crisis Management Organization. It's been said by others before me, we lacked common tools to assess the health situation. We had difficulty in sharing health data in a timely manner. We were dependent on other territories for goods and for production equipment. All this has been said. There was also still limited day-to-day coordination on health issues in general. And this wasn't a practice that was so much ingrained between member states. Also based on the fact that we had insufficient common indicators for assessing the health situation. And it finally shed light on the fact that the Europe of health was still very much constrained to what the treaty says. And indeed, we have great agencies, the Ecdc, and I salute I greet here Dr. Aman, and also the European Medicines Agency and others, but they do work within their remit. And the question arises as to whether this ought to be maybe expanded. And so challenges were those. Well, among the successes, indeed, not everything went wrong at all. It was great that we indeed could rely on these already existing strong institutions. Coordination became very tight and came in very quickly from the beginning of the crisis. And there was an amazing show of solidarity. France was in a situation where we were under great constraint for access to ECU units, and we were very lucky to count on cooperation from our neighbors, from Germany, from Switzerland, Luxembourg, and this was definitely something which is extremely positive. Of course, other countries cooperated, and other European citizens benefited from this solidarity. So I think this solidarity, which came up, it prevailed between members in the state of emergency, also helped decision makers at all levels to move fast, and indeed to advance an exit crisis strategy, which is now coming into form. There was a quick adoption of ad hoc programs in the field of health, and financial decisions were made to support these programs. And indeed, the negotiations which are now well engaged on the EU for Health program, which Dr. Bouchoy has presented, is a sign of this acceleration really in stepping up to indeed build, as we were going along, the appropriate response to the crisis based on the challenges that it was revealing.
So what can governments do? I mean, you obviously are in a position where you're speaking for a national government in lots of international institutions. So what can governments do to respond to the expectations of citizens and to encourage the sort of trust, the sort of participation in health protection measures that we've been talking about today?
Well, it's obviously been an immediate concern, and it's obviously a determinant for success in handling the crisis, which was pretty much a priority for I guess all governments, certainly the government of France. Maybe just to quote a couple of measures which we took. One was to indeed, well, there had to be transparency on the state of play. We didn't have enough equipment to protect the population, and even there were very sharp constraints on the medical staff, which was obviously absolutely indispensable. It's one of the reasons why we went into lockdown. So this the communication had to be made clear also on the fact that this was really an exceptional situation requiring exceptional measures, also due to the fact that we had to get prepared and gather the protection and preparedness measures that we didn't have at hand. So that the message had to be made quite clear, and so that was an important point. Another way to indeed engage with the population and make things understood and was to also get the support of science. And from the very beginning, President Macron asked an independent scientific council to be gathered up, relying on a few very legitimate and very well-known French scientists. It is headed by Professor Jean-François Delfrécy, and also Professor Françoise Barré-Sinoussi heads the research council. And these councils were asked to provide the government with advice which was made immediately public, and which was obviously scientific advice for the decision maker to rely upon in order to make their decisions. So this was quite new, and I think is something which has been quite useful in ensuring the public that we are grounding, that the government is grounding its decisions in science.
This open and transparent decision making that
it's definitely gathering tools in order to make that case, yes.
Before we run out of time, I have a question for you, and then a sort of follow-up question for certainly Dr. Bouchoy and maybe for others. Florence Gaudry-Perkins asks, says this crisis has underlined how interdependent the world is. She says France has enacted a €2 billion budget over 3 years for digital health, which gives an idea of the massive level of investment needed. And without that, data and AI can't sustain or scale. But she asked, what will you do? What will EU states do to help finance digital health infrastructure in lower and middle income countries? So if I can start with that, with you, Ambassador Cenu, and then I'm going to come to Dr. Bouchoy on a related question.
Oh, it's a great question, and it's something which is already in place. Can I turn very briefly to another pandemic, which is the HIV pandemic? And of course, this is one of the messages that France has been carrying with others quite strongly from the beginning of the crisis, which is to say that this COVID-19 crisis can be a massive disruptor, preventing health policies to continue on the biggest killer pandemics in the southern countries, which are HIV, malaria, TB, and we've been very active with, for instance, the Global Fund to try and mitigate the effects, together with other stakeholders, obviously, of this fund, to mitigate the effects of the pandemic. Now, for over 15 years now, the Global Fund has indeed implemented health finance programs in country which rely as much as possible on innovation and indeed digital innovation in order to step up the response to those pandemics. I was thinking, as I think it was Dr. Bouchoy was saying earlier, that it could be interesting to see how we could use digital tools in order to indeed accompany treatment or monitor treatment. And I was thinking, well, this is already done, and I've seen this app, the apps function in countries such as India for tuberculosis treatment, which is quite cumbersome and requires strong compliance by patient, with digital monitoring, with texts being sent to patients to ensure that they take their medication on time, at the right intervals, etc. And this, of course, informs the doctors who follow them, and gives a lot of scope for community health and primary health care in those countries. So it's a very promising direction to improve health services in general and particular programs to fight particular diseases in countries. And France definitely supports organizations such as the Global Fund, with the second funder of that organization, who rely as much as needed and necessary on those innovations for developing countries.
Dr. Bouchard, Rasmus van Dijk asks, how can we be sure that there will be sustainable funding for digitalization of public laboratories and local health authorities, so subjects that Dr. Amon and Professor Vila were talking about? And Rasmus says this is a factor lacking, which in his experience affected the speed of the response to the epidemic.
Yes, it's important to see how we can make sure. Of course, I mentioned the European programs. First of all, we have EU for Health, and there it's not yet, of course, finalized, but what we voted in ENVI committee and what it will be voted in Parliament. And I was also in a good dialogue with the Council and the German presidency. Minister Spahn and his team is also that the Council sees as a priority. There we give funds for European health data space and also for European health electronic record, which should interconnect and also make sure that if you go in another member state, your health record could be recognized. And this is only at the EU level. But we should also push, put conditions, incentivize, give a better score if from the European money, and especially from the recovery budget, 750 billion at the EU level, an important amount of this money is going to the digitalization in health. Anyway, one of the most important directions for these funds will be digitalization projects, because this is something as a strategic direction that we assumed even before the COVID-19 pandemics. You remember that even before, immediately after the new European Commission took the job, two main strategic directions were decided and very much supported by European Parliament and the Council. Green Deal, transformation of our societies, economies, energy systems, and the digitalization of European economy. And now with the crisis, digitalization in health should be an important direction, and European Commission could put conditions that an important amount of this money from the recovery would go to digital projects in health. And of course, national and local funds. Now economic crisis will come, so not a lot of room for maneuver, but of course there are a lot of opportunities from national and regional budgets, because this also could bring synergies and also top up the funds that comes from Brussels.
And indeed reconstruct. So thank you, Dr. Bouchard. Now's the time to bring in the two people who've been professionally listening, the two respondents who have listened to everything that you've said from beginning to end. And as I said to you earlier, I've asked them to listen from two perspectives. One is, can they see themes or gaps that we may not have noticed? And the second is from those two particular perspectives of health system transformation and the health and well-being of older people. So let me start with Professor Federico Lega, the president of the European Health Management Association. Federico, what have you heard that we might not have heard, being so involved and caught up in the conversation?
Thanks, Mark, and good afternoon, everyone. And thank you so much to the other panelists for the very interesting session that I just heard. I have two comments. One is refer more to the actions that I see that actually I heard through the conversation, and a few gaps that I also spot in the conversation that I would like to highlight now. And the second part would be two comments on policy level. One is more on the organizational, the system level. So one gap that I saw actually in the conversation is the fact, if I have to say where the money should go first in our system, given what actually the pandemic told us, and I'm talking about using the COVID experience as a learning experience for our whole system. I kind of agree that digitalization would be something there, but before that, I think it's all systems need to strengthen their primary care system, especially the community services, and especially the way they integrate social services and healthcare. I mean, that should be the only and first dominant issue on the agenda. And if I put any money from the European level into the systems, I would like to ask the system, how are you going to use this money? Let me know actually what you're going to do in the next 6 months and a year. And I want to see the money spent exactly there. And I want to see the results. Otherwise, I'm not going to give you the money for this, because this is going to, I mean, execution comes to becomes really important. Second, we learned that there's another important gaps, I think, actually in the conversation, I think need to be addressed. Again, the money going to the system, digitalization should be targeted to develop what we call patient flow logistics. So it's not just do digitalization for itself, it's how actually we use it to improve the patient flow logistics, how much we use it to improve the process through which patients go in the delivery services. So that's what I want to see, which means that in many systems, we still have health organization and system managed as they were iatrocracies, managed by the doctors, managed by the professional, with no really managerialization going on as should be. So I think that there's quite a bit of reflection that we need to do on that. Third, I think...
Can I get you to pause for a second?
Yeah.
I'll come back to you, but I think those were two strong and provocative themes, and I want to give a couple of our panelists a chance to come in on them. I mean, you put this case for highly contingent funding. I think you said, you know, if you're not doing it in 6 months or a year, you don't get the money. And you said it has to be focused on patient flow, and it has to be focused on new models of patient flow.
Yeah.
I mean, I saw Professor Vila nodding. I'm not sure if you were nodding or shaking your eyes. I saw you reacting strongly anyway.
No, absolutely. I mean, I think I'm happy that Federico made this case, but I'm absolutely convinced that at least all those from the health sector know that it is not about digitization, but that it's about process optimization for better care and for more public health. That's what we need. And whenever any processes are optimized through digitization, this is the goal. And it is clear that digitization can do a lot here, but this is absolutely at the bottom of it. It has to lead to better service to the people. The people have to be in the core of this. Both the people that are healthy as well as those people who are sick. This digitization has to serve the society. Fully agree.
And Mark, if you allow me, I think if there is one area where digital is going to have very significant impact, as Federico mentioned, it's really primary care. We know that, and in some way COVID has shown it, that we need to continue to make some progress in terms of chronic management. A large number of people that unfortunately died were people that had diabetes or cardiovascular complication. So digital here is really a great opportunity with, of course, telemedicine, with wearables, in order to make sure that patients are better treatment when they enter into the primary care journey.
If I can just add one thing, Mark, on these things of primary care, just to be provocative.
Yes, please.
One thing that I think we should actually all reflect about is the fact that we have GPs, general practitioners, or family physicians in most systems. They are basically freestanding from the system itself. So they're detached from they're not employees by the system, but they contracted in most of the system. I think this is actually, we need to change. I mean, we cannot anymore have the GPs as a sort of a counter power within the system itself and acting as a lobbying. So this is a strong actually point that we should put in the agenda of reforming health system. Now we move into that direction. But it's clear actually that to one extent actually they are a resource. On the other extent, they become a problem when it comes actually to transforming and doing the revolution we want.
Yeah.
No, you answered my question. Jürgen, I think you wanted to come in quickly.
Yes, also to Federico's first point, ideally we can combine both. I mean, take the example of Professor Wieler with intensive care beds and the number of beds that are still free. In the beginning in Germany, in the beginning of this pandemic, we didn't know. So when there are investments being made also in primary care, wherever it makes sense, why not combining both and laying the foundation? Because we see that so much more could be done actually if we had the right infrastructure in place.
Federico, I cut you off mid-flow, so I know you wanted to come back.
Yeah, I have 3 more points. One, again, is still on the system. I think another things that we learn, and it was actually underlined by some of the comments, is the fact that all systems should actually strengthening their public health authorities. I mean, we saw how much it's important to have a strong public health authority within the system, which means not just having a policy level, but having within health organization, public health specialists. So I think at the local community level or whatever, I mean, the system should be reconfiguring so they have a public health specialist employed by health organization and ready to work in crisis management together with managers and clinicians to do things in the proper way. And actually, it was a major resource for those health organization systems which have them in place compared to the other. And last 2 points, I want to be provocative. At the European level, I think the EU should do 2 things. Learning from this experience. One is generating a standardization or more homogeneity of the vaccination policies within all countries. I can't believe actually we have so different procedures and practice in European countries, and no actually a strong direction from the European community about what countries should do about vaccination. I mean, there's no question about that. Everyone, every profession in the system know exactly what should be done in terms of vaccination and where evidence-based is and where actually other kind of conversation are. So I think there should be a focus for the European policy to really steer our health system to do more in that direction. And second is using some of the money to increase health literacy through the European system. Much of the problems that we had in many countries is about the information that was passed, terrorism and so on. So, and there was an incredible experience of co-creation, co-production services. Think about how the people were actually asked to do something within their own managing their health. So, why don't we use the money to do that? And why don't we ask the health system to do that? Actually, the countries to invest in that.
Those are, so thank you. I mean, you really were clearly listening very hard. I wanted to ask, without putting anybody on the spot, I want to ask Dr. Amon and Dr. Bolshoi to come back on your last 2 provocative points, and you can feel free to be non-provocative in the answers should you wish. Dr. Amon, should I start with you?
Yeah, I mean, regarding the vaccination schedules, that is something that has been recognized, that this is, well, first of all, that it's there, and that it might also be a source that fuels the hesitancy of seeing that, I mean, you know, the vaccine is the same. Why is it applied in so different ways with doses that range from 2 to 4 in the countries? And it was very long seen as the policy part where countries do their national competence, saying this is our choice. Now, 2018, there were council recommendations on vaccination, on improving the coverage of vaccines in Europe and countering the vaccine hesitancy. And one of the actions that was we were tasked with is actually to explore a harmonization of these vaccination schedules. So it's exploring whether it's possible to harmonize that. Now, this work, of course, now has been stalled due to COVID. So we will take it up whenever we can, because right now this is, well, it's important, but it's right now not where we can focus on. But it is recognized that this is an issue.
A quick note to the producer. He was unwise enough to tell me I could run 5 minutes late, and I'm afraid we will run 5 minutes late. So just you shouldn't have told me. Dr. Bolshoi, what about this idea of targeted money and maybe standards for health literacy across the Union? Is that something you think you could see happening?
we need that. We need that for sure in order to advance a little bit. And of course, health literacy, it's an issue that it's extremely important in many EU countries. I'm not sure if we'll have the available money, but it's something that we should do. And also it is something that we need also to build coalitions with a lot of stakeholders that are not necessarily part of the health stakeholders. So it's not only us which are working in the health area, it's not only the pharma industry or other industries related, but we need also to involve Ministry of Education, for instance, Ministry of Finance, television, media in general, in order to achieve this. On vaccination, I think it will be a very important test, an extremely important test. It will be very interesting how this will happen. First of all, of course, there is a lot of expectation, and even that companies already took measures and are prepared to produce, it will not be easy because they will need billions of doses in a situation when for the classic vaccines, we already experience some shortages, even in European countries. Yeah. So not enough capacity for the classic ones, which cannot stop because all the other diseases are not disappearing during the COVID. Then, of course, it will be different vaccines with different way of administrations. And of course, we should expect a lot of anti-vaccine campaigns, which will jeopardize many efforts that we are doing, because I'm sure that a lot of those which are contesting the vaccines in present, or a lot of foreign players which would like to create mess in European Union, which have an agenda or a different agenda, will target a lot of their campaign and fake news against vaccination, hunting every small problem that we'll encounter. So here we need to be prepared not only to see them approved and working in practice, to see them produced, but also to see deployed and to take care of all the details, because this could increase the vaccine hesitancy, which is already an increasing phenomenon.
So Lily, let me turn to you, because to pick up on something Dr. Bolshoi said, and I'll let you give some more general observations in a moment, but I think vaccine hesitancy, older people around Europe should all be receiving a flu vaccine. But we know the level of it, and I know it's a field you've done a lot of work on, the level of it varies enormously from one European country to another, and the importance of it. Does that tell us something about, or should that have been a warning to us, I suppose, about the pandemic and about older people?
Well, I think it's a good point. And actually, we did some research last year actually on sort of vaccine hesitancy and attitudes to flu vaccine, particularly amongst adults. And I think what we found actually is that the sort of anti-vax sentiment of it's going to give us certain diseases or it's bad for us is actually quite low. And especially amongst adults, the question is more around, do I need it? Lots of people don't see themselves as sort of vulnerable, as at risk. And I think lots of it was sort of around that communication, people not getting clear recommendations. And I think there's lots more that, you know, we've learned from this as well as of how can we sort of communicate the value of prevention and get sort of community leaders, pharmacists, GPs, nurses better involved in actually communicating the value.
What else have you heard today? So you've listened to this whole panel and you've listened to it with that lens of a special expertise on all of us getting older in a healthy way. What else should we take away from the conversation?
Well, I think there's been lots of points, so I'll try and keep the time really short. I think one big point, and obviously I'll come at it from a sort of aging lens, but I think COVID has shown us sort of really starkly how far we've been falling behind on a lot of things that sort of have been taken for granted. And I think what Dr. Vila pointed out earlier around the sort of prevention paradox is, you know, it's really hard to convince people to pay for something that you don't see. So, you know, if it all works, you don't see that it's worked. And similarly, you know, countries, especially across Europe, have been aging for centuries. So how do you kind of create the urgency to invest in things like healthy aging? I think now COVID, while, you know, absolutely devastating, of course, potentially the silver lining will be that it can act as a catalyst to really show, look, no, we do need to really urgently act on things like prevention. We really need to act on things like healthy aging, because we've seen that, you know, across the world, and the UK is a good example, where actually we've seen life expectancy is still increasing, but actually healthy life expectancy is falling at the moment. So we're not actually, we're living longer, but not necessarily healthier lives. So I think when we're thinking about preparedness for sort of future pandemics, I think, yes, part of it is the sort of, the PPE supply, making sure we've got hospital beds, having the right sort of guidelines and regulations available. But another part really has to be that we need to make sure our population is healthy to start with. And I think we've seen, lots of people didn't have to be in at-risk groups. I think I just checked again, and in the UK we had around 2 million people who were asked to shield, so people who were sort of very severely at risk. To put that into perspective, that's sort of 1 in 30 people, and lots of that is preventable diseases. So I think this will really, really need to, show us what we can do to go upstream and prevent some of these conditions from occurring, and making sure that we're more resilient to future pandemics, and sort of the current one alike. And one point, if you don't mind, is sort of also looking to the future, and I think this is really important. So, obviously COVID isn't happening in isolation, and we need to be making sure that, lots of sort of more routine primary or preventative health care appointments that aren't happening at the moment, that they're really caught up on. So lots of people, especially who might be shielding, who might be more at risk, who actually aren't feeling comfortable to go to things like cancer screenings at the moment, who don't feel comfortable to go in for vaccines. Actually, that's a huge possible crisis just waiting for us around the corner if we don't get ready now. So I think we need to make sure that, while of course, treatment costs are going up and treatment efforts are going up as more people are sort of directly affected, preventative sort of interventions have to be rising at the same level, really. And especially as we're sort of plunging into big recessions across the world, where I think we're very inclined to cut sort of spending on things like preventative health. Very early on, we've seen this in sort of previous recessions, that we absolutely don't use that time to sort of fall short there, but actually sort of reinvest. And I think, again, sort of making sure it's an investment as opposed to a cost. And I think, lots of countries have been sort of, there's been this dichotomy of sort of prioritizing health versus wealth in this pandemic. I think if it's shown us anything, really, it's that health equals wealth, and you can't really have one without the other. So I think I'll probably leave it there. I'm happy to hear any thoughts from panelists as well.
I have a question for you from our virtual audience in a minute, but do any, actually for all of the panelists, based on, and you in particular, but does anybody want to come back on those three really important points Lily made? I mean, the idea that we are building up this backlog of problems potentially. I know that across Europe, there's been an alarming decline in the number of people who have gone for routine cancer checks, who've even gone for treatment of cardiovascular crises. Are there things that we can all do to prepare rapidly to catch up on that?
I think, Lily, you said it well. At the end of the day, what COVID has brought is that we are too much looking to healthcare expenses as an expense and not as an investment. And if we are able to change a little bit the paradigm, I think this would allow us to make sure that patients are better treated, that value of prevention is more understood. Of course, we are going to run into the, in the next, let's say, probably 6, 12 to 18 months, in a period of time where there will be a lot of economic pressure on the system, and the easy answer, which will be to cut expenses. But this, unfortunately, is not going to be, the right response for the future. So to make sure that we respect the tie, the link between healthcare and economic growth is something that we should pay a lot of attention to.
So Lily, Dr. Bouchoy, probably our last question, but one I want to bring up from the Zoom audience. Georg Phelan says, we're not doing enough research on the elderly. We're not doing enough on countering age-related inflammation and senescence, and that if we were to do the research now on the management of these processes, it would help us in future pandemics. And that may be something that Professor Wheeler and Dr. Ammann want to come in on as well. But may I start with you two, Lily and Dr. Bouchoy?
Yeah, absolutely, and I'll come in first if that's okay. I think, I mean, sort of the discussion itself is focused on how data is really key to make sure that we can tailor our interventions properly. And I think very often, and you know, sadly with things like these apps, we really need to make sure that with things like digital exclusion, we're actually reaching some of those who are most at risk. But also more broadly, I mean, we have, for example, here in the UK, and this is a slight aside, but we've got a big bill coming through at the moment on domestic abuse, and actually we stopped counting domestic abuse once you're 75 or over, as if it sort of miraculously didn't happen. And I think it's really important that you have the data to actually both make the argument, but really include people. And on that note as well, and we touched on it briefly before in terms of vaccines. So if you look, for example, at the WHO guidelines of vaccine uptake for childhood immunization, we're at 90%, and actually most countries reach that. And for some reason, for adult vaccinations, that target is 75%. So I think there's a question around sort of, you know, why is our target lower, and also, you know, why is no one even meeting that sort of lower target?
Dr. Bushroy, would you like to touch briefly on the R&D funding question for the health of older people?
Yes, of course, and I mentioned in my introductory answers to your introductory questions that we need to invest more in R&D. This is one of the lessons that we learned. I was already, even before, an advocate of investing money in R&D and support innovation, which not only by giving European funds, but also by creating the right incentives, the right ways of reimbursement to improve our HTA models, and also to see exactly how we can shift the paradigm. And I totally agree with Mr. Charmey that we need to work together in order to convince decision makers and the general public that health budget is an investment, not necessarily something that we just spend. And for this, of course, we need to invest wisely. We need to invest with transparency. We need to find a balance between what is reasonable and what is also sustainable on medium and long term. And of course, it should be a return of investment in innovation and return of risk, but in the same time, the balance should be there. But it's clear that we should go to this paradigm and see as an investment and give concrete examples how this investment will save lives, we create better productivity, will be beneficial for society, for budgets, and investment in R&D is of course crucial. Not enough money, but now a lot of opportunities, and it's a momentum now for more focus on health, for more investment in health, and more investment in research and innovation. Now, because of the lessons learned during COVID crisis.
And Ambassador Cenu, in 30 seconds, how do we tell the world this? I mean, we are in a sense the continent that aged first, I suppose, and we have this experience to pass on. How do we pass these lessons on? I am running out of time, so I'll have to keep you very brief.
I'll be very brief and say that, as many have said, that there is excitement in what is ahead of us, and it is an opportunity with this crisis and all the shortcomings that we've seen and the emergency to actually build a European Union of Health, which would be one which would really give even more sense to the fact that we in Europe apply your universal health coverage to an extent that most other regional ensembles do not. And in the universal is indeed integration of all ages, and naturally there has to be more has to be done, as Ms. Palsy has well expressed. And there are obviously other groups, vulnerable groups, which must be well integrated in this universal health coverage vision. But this is basically what we are going to be basing all the improvements that we have touched upon in this panel on, and on the fact that it is a common good, a collective good, which underpins our democracies, that this is shared, health is shared, it is an area of solidarity, which actually brings with it accountability. What politicians do about this has to be made accountable, and transparency. It is a very, very political subject and theme.
And what an inspiring thought to leave us on, that health is a common good which underpins our democracies. I think we'd all do well to remember that. It's just for me now to thank our panelists. As predicted, I wish I could have heard so much more from each of you, but your contributions were enormously valuable. Dr. Andrea Amon, the Director of the European Centre for Disease Prevention and Control, Professor Lothar Wieler, the President of the Robert Koch Institute, Dr. Jürgen Müller, the Chief Technology Officer of SAP, Dr. Christian Bouchoy, the Chair of the Committee on Industry, Research and Energy and the Rapporteur on the EU for Health Programme, Olivier Charmet, the Executive Vice President for General Medicines at Sanofi, and Stéphanie Sédou, the Global Health Ambassador for France. And thank you to Lily and to Federico as our respondents as well. So much appreciate the audience who've joined us and who've sent in questions, and I've seen a couple of tweets as well. I do hope that you all stay, because in about 20 minutes, the official opening ceremony of the World Health Summit will be shown on Zoom. Thank you all so much. Thanks. Bye-bye.
Thank you.
Thank you. Bye. Thanks, Mark. Thanks, everyone. I need to jump. Take good care. You're on mute, Mark.
Thank you, Jürgen, very much indeed. It was a great discussion.
Bye. Thank you so much.